Hi everyone, this is Dr.RUkmani Choudhary and you are watching Dr.RUkmani's Health Update. My today's topic is Phenylketonuria, PKU. This is a rare disorder, rare genetic disorders. And this is rare, uncommon, but we have to discuss. The symptom can be misdiagnosed for other problems, so we have to consider this. Very important to know about this condition, the phenylketonuria. So as the name suggests, phenylalanine is an amino acids, and amino acids are the building blocks of the proteins, right? So this is a condition in which you have, the excess amount of phenylalanine, that is an amino acid, in your body. So phenylalanine is in your body in excess amount. And why this is in excess amount? Like what happens? Normally, alanine is converted by the phenylalanine hydroxylase enzyme into tyrosine, and tyrosine helps us like to create neurotransmitters, epinephrine, norepinephrine, and dopamine. So this is a normal process. But in case of PKU, that is phenylketonuria, this enzyme is missing. In fact, due to gene defect, so due to gene defect, this enzyme is missing, means there is no enzyme, and as this is missing, so there is no conversion of phenylalanine into tyrosine. So the phenylalanine goes up, means you have excess amount of phenylalanine and there is no tyrosine. And so obviously if there are no creation of neurotransmitters, so the mental ability is affected, brain intellectual ability is affected. The causes, this is the only cause that this is a genetic condition, a rare genetic disorder in which you have defect gene, and that defect gene you have high alanine in your body, and due to the lack of neurotransmitter you have, it is a severe case, there are irreversible brain damage you have. We'll discuss later on part. Yes. So sign or symptom, see, the condition usually diagnosed in early childhood, like is diagnosed early and it is treated, so there is no harm. Why? Because the treatment is done in early stage and diagnosis is made, so there is no problem. Symptomatic treatment is there, and even the case goes like mild one, there is no harm. But if the condition is not diagnosed and there is no treatment taken, so there can be severe symptom, and this can be a case of classical PKU, classical phenylketonuria. And in classical phenylketonuria, we have like seizures, and there are trembling, shivering, and kids are hyperactive, and they are poor in like intellectual performance. There is at times there are brain damage, irreversible brain damage is there if it is not treated early. Stunted, and at times there is a skin condition, eczema like conditions. There can be like severe cases, the classical case of PKU, moderate cases, and the less severe cases. The less severe cases are those who are diagnosed early and like under treatment. The diagnosis part, how the condition is diagnosed. Condition is like one, the blood tests are done. So blood samples can be taken. Babies heal and their normal blood test. Genetic study can be done. Like so, in that study, we have like there is a missing enzyme, that is phenyl hydroxylase enzyme is missing, obviously, and there is a defect in the gene that converts the phenylalanine into tyrosine. So the defect gene is found. The search for the enzyme is made, whether this enzyme is present or not. So the studies is done by the blood sample. The diagnosis is confirmed usually. Treatment part. Hence the condition is genetical one, so there is no cure obviously, but yes, symptomatic treatment is there, and diagnosis and screen is very important. This is very crucial. Diagnosis is made by looking into symptomatic collections and obviously by the blood samples. Usually the dietary changes, there are dietary formulas in this case like PKU, and diet plays crucial role in this case. Why? Because phenylalanine is an amino acids, and amino acids are the building blocks of the protein. So you are asked to avoid, restrict all kind of protein in your diet, like whether it's an egg, fish, anything rich in protein, just avoid that. Why? That can create phenylalanine in higher amount. Reducing for phenylalanine, just avoid all kind of protein. So there are special formulas, like these are called like PKU health formulas. So you can take all these formulas maintenance of your protein centers from the health centers you can get. These are easily available like PKU health formulas, so you can get those and you can have for the proper growth and for the obviously for the protein like management part, for fulfillment of the protein, for requirement of the protein. See, you are asked to maintain your daily phenylalanine record, just monitor that, so you don't have higher phenylalanine and you don't have building up of the phenylalanine. So just maintain, just monitor your phenylalanine. Can we prevent this condition? No. These are genetic disorders. Genetic disorders cannot be prevented, but yes, screening can be done. Screening can be done as the condition is like a hereditary one. If both the parents having the defect gene and they pass into the child has the defect gene from both the parents. If the child has single defect gene, then the condition is not occur. The child can carry only the gene, can be carrier only, but not having the disease, not the classical case of PKU. For classical case, the child should have defect gene from both the parents, so that's why it is a very rare condition that both parents have the defect gene. These are enzyme assays, so your blood test is done and enzyme assays are done, that which enzyme is missing. You're planning for a baby and you are newly married, so just go for all these tests like enzyme assay test, or not. So this helps. Does homeopathy has any role like in PKU cases? What homeopathy can offer you? What are homeopathy medicine that can help you? Patient is having the symptom like the seizures and they are intellectually poor, growth they have automatic purpose. Yes, we have medicine like if the kid has Artemisia vulgaris is a very good medicine that is given in kids and children cases when they have the epilepsy fits or seizures in these cases, and the medicine can be used in the pills form. This is in the liquid form. Start with the lower doses in kids cases and just have 1 or 2 drops directly orally, or to use pills form medicine in kids cases so that medicines are mild and they are intellectually they are poor, they growth and at times they are emaciated. In that case, Bariatamur can be given. This is again a very good medicine, that is the child is weak mentally as well as physically, so in both the cases Bariatamur works amazing. So you can again liquid form, just 1 or 2 drops. If you're watching on YouTube, I have provided medicines link in description box below. You can buy medicine and you can start and just stick to your diet, health plan of PKU. Just stick to your diet. Bariata carb is given when the child has the stunt growth obviously, and the glandular like they have the tonsils, they have adenoids, works. So Bariata carb can be taken again with the help of dropper, 1 or 2 drops. Not the limited medicine. Case varies with the person, with the patient. So even medicine varies. Medicine are not fixed, it even varies. So first time, please like, share and subscribe my channel. Press the bell icon to get notified. Keep watching, keep supporting. Thank you for your time. Thank you so much.